Good morning, good afternoon, and good evening. Welcome to the webinar entitled The Impact of Nursing Empowerment on Healthcare System, organized by TaiwanICDF, Taiwan Nurses Association, and CARE International. I am Lian-Hua Huang, currently work as nursing CEO at China Medical University Healthcare System in Taiwan, and also board member of International Council of Nurses. I am very honored to moderate this webinar. As you all know, the year of 2020 is the International Year of the Nurse and Midwife. The COVID-19 pandemic has made nurses a lot more visible than ever before. The objective of this webinar is to present the importance of nurses and midwives in transforming healthcare systems, best practice of nursing empowerment, and challenges for future development. We have invited speakers worldwide. First, I want to introduce each one of them, including International Council of Nurses. First, Vice President, Dr. Pamela Cipriano. Taiwan Nurses Association President, Dr. Ching-Min Chen. Deputy Secretary General of TaiwanICDF, Dr. Bai-Bo Li. CARE International Team Lead, Ms. 𝙒𝙗𝙥𝙖𝙧 and Health and Nutrition Manager, Dr. 𝙒𝙗𝙧𝙨𝙀. Good Neighbor International Assistant Manager, Ms. 𝙄𝙢𝙥𝙗𝙧. University Indonesia Head of Master Nursing Program, Dr. 𝙒𝙗𝙗𝙩𝙗𝙗. Now, we will start our webinar. Please welcome Secretary General of TaiwanICDF, His Excellency Ambassador 𝙒𝙗𝙗𝙗𝙗 Hsiang, to give us opening remark.
Dear speakers, colleagues, friends, welcome. I'm privileged to be here for the opening remarks. On behalf of the TaiwanICDF, I would like to extend our sincere greetings to all of you for joining us today. The TaiwanICDF is the professional foreign aid agency of Taiwan. As a member of the international aid and development community, the TaiwanICDF has been responding to international development trends for many years. We use Taiwan's public health development experience and integrate the resources of domestic medical institutions to help our partner countries develop a better health care environment. The public health projects implemented by TaiwanICDF focus on the government's health facility and the community levels. We aim to assist partner countries to improve their capabilities in policy planning and strategies, and enhance healthcare personnel training and community health education to move towards the goal of universal health coverage. In all our public health programs, nurses are a crucial element for successful implementation. Nurses and midwives account for more than half of the global health workforce, and it is imperative for countries to support and invest in them. We must empower nurses through strengthening their professional abilities, which will benefit nurses, patients, and health systems, especially for countries without sufficient healthcare personnel. The World Health Organization has designated 2020 as the International Year of the Nurse and the Midwife. It could not be more timely to highlight the importance of nurses and midwives, particularly in the battle with the COVID-19 pandemic. Nurses continue to be at the front of patient care, and we will not overcome the pandemic without them and other health workers. At this difficult time, the TaiwanICDF has been actively providing necessary support to partner countries, including supplying personal protective equipment, improving standard operating procedures of health facilities, and enhancing local workforces with pandemic prevention education. In the post-pandemic era, the TaiwanICDF will continue to support partner countries to promote nursing empowerment and further assist people in need. We can achieve universal health coverage and have a healthier and safer world if we work together. Finally, I would like to take this opportunity to express our appreciation to Taiwan Nurses Association and CARE International for co-hosting this webinar. Today, we are going to address how empowerment would benefit the nurses and the midwives, as well as identify challenges for future development. With the cooperation between the TaiwanICDF, Taiwan Nurses Association, and the CARE, I believe this webinar will offer valuable lessons on nursing empowerment. Again, I would like to express my appreciation to all who are devoted to yielding fruitful results in global public health and medical cooperation. Thank you.
Thank you very much, Your Excellency Ambassador Hsiang, for your words of wisdom. Next, we will have our future address, Dr. Pamela Cipriano. Pam is the Dean of University of Virginia's School of Nursing. Pam is known nationally and internationally as a strong advocate for growing nursing influence on healthcare policy and leading effort to advance the role and visibility of nurses. She is going to present Empower Nurses, Leaders Saving Lives and Shaping Policy. Pam, the floor is yours. Please start now.
Thank you very much, and I would like to thank the Taiwan Nurses Association, the TaiwanICDF, and CARE International for the opportunity to be with you today. For me, it's morning. I know it's evening in Taiwan. And if you go to the next slide. As you've heard, this is the year of the nurse and midwife, and while we're not able to celebrate, I think it's really important to be pointing out that this is a time for us to raise our profile as nurses, to be able to raise our voices, to increase our influence, and be able to address the issues that we know are important, not only for the profession of nursing, but for us to be a force to bring health to the world. And so as all of the organizations that came together in acknowledgement of the year of the nurse and midwife, we know that one of the driving forces was the WHO recognizing that the world really needs 9 million more nurses and midwives if we're going to achieve universal health coverage. Next slide, please. So the messages that came with the designation of this international year are to strengthen our professions, to be able to boost leadership and improve health services, but also influence our governments to make sure that there is a stronger investment in nursing, and also be able to acknowledge that it is nurses who are really going to be the groups that will help us achieve health for all. Now, as you may have tuned into the opening of the World Health Assembly, we heard Princess Muna very strongly address the need for us to make sure that we move from just applauding nurses heroes to making sure that we take action. And her tagline was, applause without action is no longer acceptable. If we go to the next slide, again, our focus is to be able to achieve health for all. And that really means that we're going to focus on our communities. And that could be things from climate change, which nurses are passionate about, to improving the amount of primary care that is delivered, to bringing care to remote areas, which nurses have done for many, many years, to be able to address the needs of the underserved, and to focus on health promotion. Nurses have fundamentally been the ones to make sure that we have people immunized, that we are looking out for our aging population. We have participated in the 2 declarations for primary health care, the 𝙒𝙗𝙧 Declaration in 1978 and the Astana renewal of that declaration in 2018. knowing we cannot attain universal health coverage or the sustainable development goals without primary health care. Next slide. We know that nurses are fundamental in pushing the boundaries, and we continue to be really pleased and amazed at the creativity of nurses, whether they're presenting mental health services in remote areas or outreach in places where we have nurses as volunteers in mobile clinics, building global nurse capacity, managing tobacco dependency as is being done in Hong Kong, to addressing COPD in China, to look at increasing health literacy, helping hepatitis C patients in nurse-led clinics. Next slide, just a few more images. Again, that we focus on patient-centered care, patient safety, oncology during the pandemic, making sure services are provided, refugee care, disaster relief, and the list goes on and on. Next slide. So what's important, if we want to continue to have nurses who are empowered, one of the first places we need to recognize that their work is critical and really depends on the environment is in our hospitals. So while nurses are everywhere, we need to make sure that in this very complex, demanding environment, that we have an environment that in the hospital that is safe. We want to retain our nurses. We want them to be able to have a satisfying practice, because we know that that is what's going to be able to provide the best patient outcomes. So we want them to have a healthy and supportive work environment. About 12 years ago, the American Association of Critical Care Nurses issued its first report on healthy work environments, and then they updated that 2 years ago. And there are 6 standards that have continued to be present: skilled communication, effective decision-making, appropriate staffing, meaningful recognition, and authentic leadership. And they affect all of us and are part of what we look to make sure that nurses are in charge and empowered in their environments. Next slide. Another model that you're very familiar with is the magnet recognition model. And I'm pleased to recognize that the Taiwan Adventist Hospital in Taipei City has recently been deemed a magnet organization, which is really exciting. There's also one additional hospital in China, the 𝙒𝙚𝙗𝙗𝙧 Hospital. And so we're very pleased as around the world, hospitals are recognizing how important it is for their whole organization to focus on the development of empirical outcomes. And as we look at this model of magnet and why it is so important that we support professional practice, we're looking at transforming the future through leadership, having exemplary professional practice, which means a very comprehensive role for the nurse. We also believe in creating new knowledge through innovation and improvement. Nurses are applying evidence, they're building new evidence, and contributing to nursing science. And transformational leadership, which I'll go into in just a second, is an important element of that as we then measure outcomes, not just clinical outcomes, but workforce outcomes and other patient and public outcomes. So moving to the next slide, I want to talk just a minute about structural empowerment, because this is where leaders really come together in the organization to make sure that we are creating that empowering environment. And so it calls for being innovative. It calls for leaders to make sure that the support for professional practice, partners, and relationships are in place. We know nurses have always been focused on improving patient outcomes, a very strong part of what we do, particularly in complex environments. We want to be able to have our leaders demonstrate how important our mission, vision, and values are, and use their strategic plans to be able to not only advance nursing, but nursing in the care of patients, and that we support our staff in this process. Next slide. So our work environment, we know, affects quality. And as for those of us that have been in nursing a while, we know that we have to continue to look at transformational leaders as the key to making these things happen, not just solving problems, but empowering our staff. Next slide. So empowerment means that we are improving quality, and with that comes tremendous savings of mortality and morbidity, but saving dollars as well. Next slide. So the basic principle is that we are moving from governance that is simple self-governance to professional governance, which brings satisfaction with that to nurses who are involved then in decision-making, who can feel that empowerment, who can live that empowerment, who are welcomed at the decision-making tables, who are able to have a practice that allows them to influence the outcomes of care. Next slide. So really the message with governance, that is professional governance, is we have to unleash the power of nurses, because all of the outcomes are what we want: better health, better access to care, better outcomes. Next slide. And you can go to the next one. So shaping policy is also an important part of what we want to allow nurses to do and help them to do. That's where we are building the empowerment of nurses to be able to not only influence our practice, but influence the outcomes of care, to be sure we are addressing social justice issues that are very important to nurses as we care for populations. Next slide. We also know that economic empowerment is important for nurses. In a study that was done with Nursing Now 2 years ago, it was very clear that we have salary inequities in nursing. Men are enjoying higher salaries in some of our countries, and they're also accelerating their path to leadership, because nurses often provide more of the domestic care, and so it slows down their leadership trajectory. So we need to be pursuing economic parity as well. Next slide. And we know that the Taiwan Nurses Association is a very active force in terms of political empowerment, very active in the International Council of Nurses, participating in the World Health Assembly, and all of the activities that really help grow global influence. Next slide. So we also know that we are critical in addressing the non-communicable diseases. This is where universal health coverage is going to come in. Next slide. And part of that, again, is our leadership role. And I applaud the Taiwan Nurses Association, who are very important in bringing leadership for change to the nurses of Taiwan, as well as participating in many other leadership activities. Next slide. We also know that this is important for women, no matter what country we're in, to be able to empower professional behaviors. Next slide. And so in doing that, we want to use our voices. The ICN has been very instrumental in bringing case studies to the forefront, so around the world people know what nurses are doing. Next slide. So we want to be sure we are not afraid to use our power. We need to be able to band together to make sure that we help all of our peers and that we have our voice heard. Next slide. And so if we're going to solve the problems of the world, our vision is to have very empowered nurses, because we know we are saving lives, and we are influencing policy that is good for our people. And that's, thank you so much for having me today.
Thank you, Pam, for your inspiring speech. Next, let me introduce Dr. Ching-Min Chen. Ching-Min is professor of Department of Nursing, National Cheng Kung University in Taiwan. Ching-Min has been dedicated to the area of healthy community and gynecological care. She has served as president of the Office of International Affairs at NCKU. Also, she has been the legislator in Taiwan. She will present nursing empowerment strategy and challenge. Ching-Min, the floor is yours. Please start now.
Thank you, Dr. Huang, for your warm introductory. We, Taiwan Nurses Association, are very glad to have this opportunity to share what we have done to empower our nurses. Next, please. Echo to Dr. Cipriano's excellent presentation on what ICN event on Nursing Now. We'd like to share that we, Taiwan Nurses Association, respond to ICN and WHO's call for action. Immediately, we launched our Taiwan Nursing Now event right in February of 2018. And our mission is try to raise the status and profile of nursing and also empower our nurses. Next one. And our Taiwan Nursing Now has a focus on 3 major approaches. First, we like to raise our self-awareness, try to enhance our profile, including upgrade entry level for our nursing education expand role and function of an advanced practice nurse, and promote diversified and innovative nursing care model, and also maintain fair social welfare and upgrade social image. And secondly, we like to lobby government to invest in nursing by creating a decent work environment, expand political involvement of nurses, ensure nurses' rights and influence, and also we like to put nursing in policies into practice. And by doing this, we like to have our people be touched and moved and respect our nursing values. Next one, please. And this campaign, as you can see here, has received very good positive response from all over Taiwan. So Nursing Now campaign are booming everywhere in Taiwan. Next one. And on top of this, we also prepare some leadership programs in here by our TWNA, the top 3 that I will be mentioned later on in more detail. But as you can see here, the last 3 is what we have done to echo Taiwan Nursing Now that we have held since 2018, including National Nurse Students Professional Forum, Nursing Youth Camp, and also Nightingale Challenge in order to promote and implement for our younger nurses. Next one. So for this GNLI, which stands for Global Nursing Leadership Institute, that you can see here, we send out, previous one, please. Previous slide, yes. As you can see here, we send our nursing delegates to ICN for this 1-week intensive training course. And for this training, it only takes it only takes 30 participants all over the world. So this is very competitive for our nurses to participate. Next one, please. And based on GNLI, we also have our own Nightingale Nursing Leadership Institute that we try to cultivate our local nurse leader to participate in policy making and politics. As you can see here, we have almost 250 graduates already. And the next one. As you can see here, we are very proud to say that the TWNA, as far as we know, we are the only National Nurses Association that have been certified by ICN to have our own leadership for training program held in our nation. And we also have our certified trainers not only provide training in our country, but also provide a regional training in Asia countries. Next one. And this hybrid ICN Leadership for Training course that we just held last week, even though the pandemic having happened all over the world, we still held this leadership training program in Taiwan, also in person, also virtually. You can see the next slide. Next slide, please. You can see we still have this program. And on top of this training, we also do some political, next one, please. We also do some political advocacy in order to empower our nurses. This is the picture that we, you can see that we went to our presidential house to lobby in government's investment in nursing. Next one. So many nurses has been appointed or elected to senior government position to date. So they have used their position and authority to impact positively in the development of nursing in Taiwan. Since 1989, you can see the first nurse leader was appointed as Director of Department of Health Service, and she has also been the Deputy Manager of National Health Insurance Administration. Next one, please. So this is Dr. 𝙒𝙗𝙦𝙦, and she is our first nurse leader in the key position. And in 2004, we also have our first nurse leader was appointed as the Deputy Minister of Health and National Policy Advisor to the President. Next. And since 2004, we start to have our chief nurse officer working in the national government. Next one. And you can see here, since 2008, we have 2 nurses who has been appointed by the nation's president to serve in East Yen and also National Investment Institute. And next one, 2018. That's me. I have been sitting in the position as the legislator. I'm the second legislator in the Taiwan's history. And also the 3 other ladies you can see in the picture are our chief nurse officers. Next one, please. How we can have such a successful story is that we try to lobby our government to invest in nursing. So like the picture you can see here is that we have our delegates from TWNA, and TWNA is Taiwan Union of Nurses Association, to visit our national president in 2008. And because of our petition, so we have government support for me to become a legislator at large. Next one. So in the past year, I have this privilege to speak out for our nurses. So I served in my term for 1 year and 2 months. And even though right now I stepped down, but I still, as a standby legislator at large at the ruling party, and is seeking to have another opportunity to serve for the next term. Next one. And not only me, we also have our president's support to have our former president, Huang, to be the minister without portfolio in the examination yen. So despite, next one, please. Despite all these tremendous efforts we have done, we still face many challenges, both globally and also locally. Next one. So TWNA is a member of ICN. Because of this, we have a close relationship with WHO and ICN's policy on their global priority. As you can see here, since 2016, we know how to build up human resource for health is the top priority for WHO in order to reach the goal of universal health coverage, to reach out for the SDGs. Next one. And based on this, you can also see Dr. Cipriano also present on this one, is that in this year, WHO published the state of the world's nursing report by providing this big data. So every national nurse association can use this data to make an effective dialogue with the policymakers, request them to invest in nursing. Next one. Even though we are not a member of WHO, so we did not have this data in WHO website, but we still consider this indicator, make up our own data. So based on this indicator, we effectively make the dialogue in what we put in our priority settings. Next one. So you can see in our national context, we can see that our focus will be on educational reform, investment in young nurse leaders, and emphasize more nurse politicians cultivation. And also we like to have our nurses' voice to be heard. Next one. So as Dr. Cipriano just mentioned that even though all this pandemic, we still want to have our nursing effort to be seen. During this pandemic, Taiwan Nurses Association really have our vital leadership be seen all over the world. Next one. So during past year, we have been collecting all the case studies, all the stories to publish these 2 books and made up the video based on these 2 books. And this video and 2 books has been widely circulated to have people seeing what nurses has been done. Next one, my last slide. You can see in conclusion, the most important message we want to deliver is that for the largest nurse organization, what we have done is try to encourage a consensus built among nurses. And we try to have our professional image to be seen through the social media. And we try to lobby to have nurses to be seen by the politics and to have nurses to sit in the table. So by doing so, all of this will be mutually beneficial for all peoples, and we can finally ensure the quality of care for the public health. Thank you so much.
Thank you, Jimmy, for your powerful presentation. Now, I'm going to introduce Deputy Secretary General, Dr. Baibo Li. Dr. Li is an expert in international agriculture, human resources development, international development and cooperation, international NGO and NPO. He has devoted himself to international cooperation and development program for over 20 years. His topic is nursing empowerment and strengthen health system, experience of the Taiwan ICDF development project. Dr. Li, the floor is yours. Please start now.
Okay, thank you, Moderator. Also, dear panelists, distinguished guests, ladies and gentlemen. It's a very great honor for me to present the topic related to the nursing empowerment and strengthened health system experience of Taiwan ICDF development project. This is my outlines. It's the first one, WHA resolution on nursing and the midwifery. Second part, Taiwan ICDF introduction. The third one, nursing empowerment through training of a trainer, TOT. The last one, the lesson learned, also conclusion. You know, the WHO resolution on the nursing and midwifery can date back since 1949 in the World Health Assembly. The latest of this one is in the 64th WHA of 2015. The WHO also designed 2020 as the International Year of a Nurse and Midwife in honor of 200th anniversary of the Florence of 19 years birth. As we know, nurse and midwife account for the nearly 50% of the global health workforce. Is a will show you how Taiwan work on this field. Let me introduce the Taiwan ICDF. The Taiwan ICDF, formally established in 1996, is a specialized official development assistance agency. The functional character lacks the U.S.A, also JICA. We implement over 90 projects around the world every year. There are major 5 key areas of our operational projects, including agriculture or agribusiness, environment, public health, education, and ICT. You know, here I will, next please, I will focus on the public health of this presentation. Next. The mention about the public health projects include maternal and infant health care, non-communicable disease prevention and control, health information system enhancement, emergency response. We aim to work with Ministry of Health to further strengthen healthcare system in partner countries. Now, we have 11 public health projects operated in Africa, Latin America, Caribbean region, and Asia. Now, I'd like to introduce the Taiwan ICDF public health projects. You know, have been designed into 3 intervention models. at the government level, we assist partner countries in policy making through providing evidence-based health information. In the health facility level, we build the capacity of health personnel and strengthen the function of health facility to enhance their medical services. And at the community level, we integrate the resources to promote the health awareness, including empowering community health workers. I will take two examples to show you how TaiwanICDF strengthens nursing education to enhance the quality of health care and health system. All of will focus on the nursing empowerment through training of trainer, TOT. You know, TOT is a strong predictor of sustainability because of the potential for upskilling the workforce rapidly by developing local educators. You can see that's the style of the chronic disease that the project in Belize. This project trained 10 Belizeans, the CE instructor in Taiwan, and conduct the local training for 138 the health personnel on kidney disease prevention and control, including 20 dialysis nurses at the health facility level. And then the project cooperated with the CE instructor to conduct the local training on health education promotion to 305 public health officers. Also work with health promotion officers to conduct the health education activity to over 35,000 people at the community level. You know, those projects, next, is a very focused on the localization. You know, the localization could be, localized for the sustainable development. We set up partnership with the nurse and the midwife of a council of Belize. You know, the 4 nurses trained in Taiwan. Also the 16 diagnoses, the complete the local training, and 20 including those 4 trained in Taiwan, and certified by the nurse and the midwife council of Belize. Also standardize the course framework for the continuing CKT education. You can see this right-hand side of this picture. That's when the nurse entitled that the registered dialysis nurse, she said the happy period nurse. Also the corporation marked the milestone of a CKD training in Belize. We believe that there are more and more dialysis. The nurses will be trained in the future to promote better health to care the CKD and the dialysis patients. The next, in the Kingdom of Swatini, the project title is Maternal and Infant Health Care Implement Project in this country. You know, this project trained 12 C instructors in Taiwan. This 12 C instructor conduct the local training on case management of a high risk pregnancy for over 100 nurses and midwives. They also conduct the local training on healthcare promotion for over 300 rural health the motivator. Next, we will to mention about very confined the institutionalization. The institutionalization, will introduce the case management mechanism. Why? Because due to that high maternal mortality rate around 389 per 100,000 live births in 2015. The Taiwan ICDF project, the manager introduced such kind of a mechanism to target area. Just mentioned the previous about the 10 nurse and the midwife trained in Taiwan, and 131 nurse and midwife complete the local training on case management at a high-risk group. So the target group, 157 high-risk cases tracked from the July 2019, the end of the project, to the September of 2020. The result is 0 deaths. So such kind of a successful case. Most importantly, the nurse knew the history of this, the high-risk group. When these pregnant women delivers these babies, nurses were able to reduce the level risk and facilitate the small levels. Now I will like to make some conclusion about it's also the lesson learned. When empowering the nurse and the midwife, it's important to consider first the localization is the key to sustainable development. For example, working with local professional association can make the empowerment continue after project phase out. Second, the tailor-made project should be based on local context to ensure effective and sustainable outcomes of the project. They further improve the quality care and the patient safety. Thank you for your attention. Thank you.
Thank you, Dr. Lee, for your wonderful sharing of Taiwan ICDF experience. Next, we have two speakers from CARE International. Ms. Anushka Koyampa is CARE lead for reproductive health in emergencies. Anushka works to strengthen integration across sectors to ensure CARE's response are people-centered and gender-sensitive. Dr. Kawa Tong is the Health and Nutrition Manager at CARE South Sudan. Kawa has over 20 years of experience in international development. She is an advocate for dignified human living, equity, and transformative policy. They are going to present CARE's COVID-19 health response, role of nurses and midwives in South Sudan. Anushka, the floor is yours. Please start now.
Thank you, Julianne. Hello, everyone. First, many thanks to Taiwan ICDF and Taiwan Nursing Association and our impressive panelists for their collaboration on this important event. Today, Dr. Kawa and I will present on the role of midwives and nurses in CARE's humanitarian programming, including within the COVID response. I will first provide information on our global approach, after which Dr. Kawa will present on the situation in South Sudan. Next slide, please. First, for background, CARE works to save lives, defeat poverty, achieve social justice, and fight for women and girls in 100 countries. Our health equity and rights programming focuses on community-centered health system strengthening, adolescent programming, and public health, including sexual reproductive health and rights in crisis settings. Localization and gender are at the center of our work with a nexus approach across all of our programming. As frontline health workers have a key role to play at every stage of the humanitarian program cycle, which is shown on the slide above, midwives and nurses play a key role at every stage of this humanitarian program cycle. For example, in the preparedness phase, we believe that competency-based training and follow-up through localized training rosters, as well as integration of competencies in both pre-service and in-service capacity building for midwives and nurses on items such as elements of the clinical components of the MISP, the Minimum Initial Service Package for Sexual Reproductive Health in Crisis, is absolutely crucial. During emergencies, during acute emergencies, we know that they are on the front lines providing these life-saving services in line with the Minimum Initial Service Package. And as we transition back to recovery, we work on improving quality of service delivery. Finally, we believe that advocacy for the empowerment of frontline health workers on issues of task shifting and leadership are absolutely critical. Next slide, please. Here are a few examples from around the world. In the interest of time, I won't go into too many details, but I wanted to mention that we take this approach in emergencies across the world, empowering midwives and nurses to maximize their potential in services as they work to serve their communities and ensure access even to the most stigmatized services. I'll give you the example of Chad. There was a policy on the books that blocked women from getting access to the full range of contraceptive methods, including highly effective, long-acting reversible contraceptives that many women want. The policy said that only physicians were authorized to provide these highly effective methods, in essence, creating a powerful barrier for most women accessing them. To address this, in refugee camps in Chad, CARE partnered with the Ministry of Health to develop evidence that showed that trained nurses and midwives could in fact effectively and safely provide a range of contraceptive methods. And once these methods were available to women, we actually saw a dramatic increase in demand for contraception, and specifically a great demand for these highly effective long-acting methods, IUDs and implants. So there had been a latent demand for these services, but before, no one was able to meet the needs of these women. We used this evidence to actually change a policy that was in collaboration with the Ministry of Health there. Next slide, please. These are the 4 key components of CARE's COVID-19 response. As you can see, first and foremost is protecting and supporting frontline health workers, along with strengthening communities to stop the spread of COVID, while ensuring continuity of life-saving sexual and reproductive health services. Moreover, shielding and standing with women and girls and the most marginalized groups, ensuring that no one is left behind, is truly core to our work and often delivered by nurses and midwives in their communities on the front lines. I know many of our colleagues have highlighted the importance of advocacy, and I want to highlight that we focus on, really addressing gender-related inequalities and barriers in the health workforce, protecting frontline health workers from stigma, attacks, and harassment, which is particularly crucial in humanitarian settings, and ensuring that sexual reproductive health and rights and gender-based violence services remain prioritized throughout the COVID-19 response. I will pause there and hand over to my colleague, Dr. Kawa. Next slide, please.
Thanks, Anushka. I will now shift the focus of the presentation to South Sudan and specifically the role of midwives and nurses. Next slide, please. Even before the COVID-19 pandemic, South Sudan was facing severe shortage of all categories of trained health professionals. There is 1 doctor per above 65,000 population and 1 midwife per close to 40,000 population. And South Sudan relies on inadequately trained or low-skilled health workers. At the same time, we must highlight that 70% of skilled workers are nurses and midwives in this country, delivering the majority of services, including in the hardest to reach areas and most crisis-affected parts of the country. Even during the pandemic, nurses and midwives have been on the front line, ensuring continuity of life-saving services. Still, they are among the least recognized and least resource cadre of workers, which must be addressed. Next slide, please. I also want to take a moment to highlight the impact of COVID-19 in South Sudan. So far, 28% of counties in the countries have been affected, and only 40% of the funds to implement the National Response Plan for COVID-19 has been secured. Given that frontline health workers, like nurses and midwives, are on the front line serving health facilities, many of them has contracted COVID-19. In fact, many frontline health workers have been diverted from providing continuity of life-saving health services to manage COVID-19 cases, putting them at a greater risk, sometimes with limited PPE. In addition to noting the specific needs and contribution of frontline health workers, it's important to note the adverse impact this diversion of the resource in having on reproductive, maternal, and child health issues such as malaria, access to family planning, and maternal health services. Next slide, please. This shows the map of South Sudan. We are this country here in Africa, in the eastern part of Africa. We are bordered by Ethiopia, Uganda, Kenya, Central African Republic, and Sudan. So CARE South Sudan is currently working in 8 states of the country across 80 health facilities with the support of 59 nurses and 27 midwives, providing a range of health and nutrition services. Next slide, please. A few examples of our response efforts include CARE has trained and mobilized midwives and nurses on community-based surveillance, risk communication, and community engagement to listen to and address myth and misinformation on COVID-19 and provide accurate information to reduce transmission of the disease. Support for triage and screening for COVID-19 while they are implementing adapted protocols to ensure continuity of the reproductive, maternal, neonatal child health services. Next slide, please. While we have included here several remaining areas of challenges and future direction, I would like to end by recommending the following. First, the importance of investing in midwifery and nursing training institutes, along with adequate financial support to them for their essential contribution to its response efforts. Second, expanded mandates through task shifting, as well as greater leadership of midwives and nurses in decision-making for emergency preparedness and response. Thank you very much for listening.
Thank you, Anushka and Kawa, for your insightful presentation. Now we go to Good Neighbor International. Ms. Jin-Young Park is Assistant Manager at Global Health Team. Jin had a variety of work experience and has been established strategy development, project management, and negotiation in international settings like Tanzania, Nepal, and Bangladesh. She will present empowerment in maternal health nursing. Jin, the floor is yours. Please start now.
Thank you for TaiwanICDF, Taiwan Nurses Association, and CARE International to lead this event. Today, I'm so privileged to present what and how we have been impacting several countries to improve capacity building of nurses and midwives in primary health care. Next, please. This presentation is structured with the overview of Good Neighbors Health Project and what we observe the barriers for nursing empowerment and impacts of the barriers in primary health care. And I also like to share the maternal health project in Tanzania and Nepal and how we have been strengthening and increasing the nursing empowerment. Next, please. We have implemented over 23 health projects across the world for providing health service, which is funded by COICA and international organizations. Through our strategy, we have been improving accessibility to local health service and providing quality healthcare service as well. Among the numerous of our projects, I just selected 2 of maternal health projects in Tanzania and Nepal that we have supported primary healthcare workers. Next, please. Before designing the project activity, what we observed, there are several barriers for nursing empowerment. so that nurses and midwives are vulnerable to provide quality of care due to lack of workforce, lack of medical supplies and equipment, poor facility management, lack of training and skills, and unsafe working conditions. Then here is some results of such a given barriers in maternal health. They have lack of self-confidence of their clinical practice. Then it influenced to pregnant women not trusting health workers and not visiting primary healthcare facilities. Therefore, the frequency of the visiting and birth rates at the primary healthcare facilities is getting decreasing. So number of high-risk birth in secondary healthcare is increasing due to the lack of maternal health services at the primary healthcare level. Therefore, we have been learning is that strengthening nurses and midwife is key to improve the quality of care through the implementation of training, education, as well as the provision of the medical equipment and refurbishment health facilities. Next up, please. In Tanzania, we are focused on the capacity building of health workers in Kishapu district to provide quality of maternal newborn child health service for contributing reduced maternal and newborn mortality. During the early phase of our project, Kishapu district has no any health facility providing basic emergency obstetric and newborn care. It was not only the issue of the lack of equipment and medical supplies, but also the shortage of the skilled health workforce. So we update the knowledge and skills and attitude of the healthcare providers to develop their competencies and confidence in provision of the emergency obstetric conditions. So these are the statistical results with given 4 indicators at the end of the project. As you can see, the most of the outcomes improved, especially the percent of the mother who receive PNC care dramatically increasing to 83%. Next, please. This is a summary that how and what we implement in order to build their capacity. So we trained 614 health workers, including 305 of nurses from health center. There were delivered this training, such as BMOC, essential newborn care, mentorship, and data collection training with a various methodology, such as group discussion, role play, and demonstration with the models. Especially the BMOC and essential newborn care training were divided into 2 parts. 1 week of knowledge and skills in the classroom, another week of the practice. And also the clinical mentorship was improved their communication skills into interpersonal relations for creating good working environment. Next, please. So now let's move on to Project of Nepal. In April 2015, severe earthquake struck near Kathmandu in central Nepal, and Lian-Hua district was the most earthquake affected. So as post-earthquake reconstruction project, we have been implementing from 2015 till now to sustain and enhancing their maternal newborn child health service. All the results in 5 indicators shows the improvement of the maternal health, especially the percent of the trained SCBA nurse availability, increasing to 50%. Next, please. This is a short summary of the capacity building of the nursing through the Nepal project. 10 of the nurses and midwives learned skilled birth attendant training, contraceptive implant, and maternal newborn care, neonatal care for pregnant and female patients. Next, please. Before closing, I'd like to share the importance of the training for nursing empowerment in order to perform the evidence-based practice through one of the interviews in Tanzania. Her name is Samuel. She said, "This poor condition discouraged pregnant women to attend the health facility during pregnancy and even to deliver. But now we assure community members that we will continue providing them with a quality care because they are well-trained and health facilities has improved." In conclusion, I'd like to summarize the lesson learned. Strengthening the midwifery education can demonstrate in improving the quality of maternal care service. And with providing safety and quality in midwife practice in primary health, the pregnant woman build a trusting relationship to health workers and improve access to and utilization of the maternal health care service. And health workers are able to identify danger signs of the pregnancy. Finally, all this impact to reduce the maternal and newborn mortality rate. I just want to make a quote for emphasizing the lesson learned from us. Empowering frontline nurses and midwives in primary health is the key role to promote maternal health care outcomes. Thank you for listening.
Thank you, Jim, for your excellent international cases sharing. Last but not least, Dr. 𝙒𝙗𝙧𝙨𝙗𝙧 from University Indonesia. Hani focused her activity on developing nursing leadership and management in Indonesia. Activities include policy development, consultation, capacity building, training, etc. Hani attended the third ICN Leadership for Change program in Taiwan and carried out a pilot project in developing the competence of nurse manager in Indonesia. Her topic is leadership training experience from Indonesia. Hani, the floor is yours. Please start now.
Professor Huang is our father and mother in LFC program. In according with that Prof. Ching-Min said about one of the LFC program, I will convey the implementation of the LFC program in Indonesia. Now I will present the result of our homework from LFC program. We say leadership training experience from Indonesia. There is my outlines. For the background, the competency of nurses, managers as head nurse need to maintain. Next slide, please. One of which is using training. Training is a means of non-formal education, must be well planned so that the ability to the train is not lost even after the training has been completed. So the next, there is no competency provision of the head nurse. Training is one of the important activity carries out the maintain and improve the competency of the head nurse. Good training required good management so that training objective can be achieved optimally, but not all of training is like that. So we try to improve the head nurse competency through training with apply quarter 8 step in development in nursing leadership and management training program. And try to improve the head nurse leadership and management skills. For method, this study we call Leadership for Change project. The project developed using combination action research method and quarter 8 step plan. The need of the 18 head nurse is carrying out their duty where explored through focus group discussion and baseline survey. The improvement of 95 head nurse competency after training was measured through pre and post test. According to the quarter step change model, we do step by step. For the next slide, please. The step 1 is create the sense of urgency. The process should start with collect data to establish the sense of urgency among the manager and employee. Head nurse self-assessment results show the head nurse who feel they don't have leadership skills were 39%. The majority head nurse has diploma degree, and majority disagree when it is said leadership can be learned by experience without the leadership training. Mostly feel they had not received head nurse training before. And 31% experience role stress when they were a head nurse. For second step, we do the putting together a guidelines coalition. In this step, dedicate to bridging together competent teams with the right skill, qualification, reputation, connection, and sufficient power. So we do a discussion with head nurse, nursing department, and with the policy focus and setting clear goal and developing an environment, trust and commitment. The next step, we do developing new vision and strategies. Our new vision is make the head nurse competency according with own standard. The next step, we do communicating the change vision. The step make use of the organization communication channel to get the word out. This may include from paying from email and newsletter to the company intranet. We do communication for every stakeholder and to get the commitment, more commitment for this program. The next step, we try to remove barrier to action. We try do more discussion to make the barrier from site is removed from to the activity. So after that, we do the step to accomplish short-term win. We try for the next please. We try break down the change project into small part with a short-term goal. We try to formulate a training curriculum, formulation of competent curriculum teams and trainer, arrange the training schedule, implementation of training and training evaluation. So after that, we build the change, and the last step, we make sticky chain stick. We try to reinforce for the next please. We reinforce the change by demonstrating the relationship between every party. So according this step, for the evaluation, we get the evaluation was carried out after training through pre and post tests by answer 54 selected item multiple choice regard the competency need to nurse manager. The main score for the pre and post test participant increased from average 53 to 80. Mostly trainer participant has increased this score, but not all of this get the 100 score. For the conclusion, we do leadership training is quite effective in increasing the knowledge and opening up broader insight about head nurse leadership. And the step of Kotar step can be used as a reference in improve the leadership ability of the head nurse through leadership training. And a good perception for head nurse about the importance of competency development through training is a good initial capital to make change and improvement of carrying out its function as a nurse manager. So our recommendation is evaluation improvement of the curriculum periodically, so that the material from the training provided can be up to date and according with the development need. And the implementation leadership and nurse management training is carried out continuously, and the hospital and related parties provide full support the head nurse competency development program. That is my presentation. Thank you for listening.
Thank you, honey, for such a fantastic experience sharing. Now, it's time for Q&A. We will pick up some questions from Slido and invite speaker to answer. If due to time limitation, we could not answer all the questions, we will provide answers later on the TaiwanICDF website and Facebook. Stay tuned. Okay, we do have some questions. Let me repeat. The first question is to Dr. Cipriano. I will read it out and then invite Dr. Cipriano to answer the question. The question is, the roads to battle with the pandemic still full of uncertainty. Do you have any suggestion to keep up nurses and midwives' motivation at work?
Thank you, Dr. Huang. There are two really important things about the COVID era. And one is that nurses, as well as the rest of the healthcare team, have to feel that they are physically safe as well as psychologically safe, because those are the forces that will allow them to continue to do their work. It's not only the nurse that has to have the motivation. They have to be a partnership with the place that they're working, with the leaders, because it is really their responsibility to make sure the nurses have adequate staffing, that they have adequate protective equipment, and that the environment that they're working in supports them. Because nurses still have a high level of fear of contracting COVID as well as bringing it home to their families. And that's universal around the globe. The other thing that we've seen in surveys in the United States is that nurses do not feel valued by their organization. So what we need to do is we need to get our nurses to be in conversation with the leaders in their organizations to be very clear. They need to be safe, they need protective equipment, they need appropriate staffing, and they need to be valued by their organization because they're being kept safe and they're being recognized for the amazing work that they're doing.
Thank you, Dr. Cipriano. We come up with the second question. This question is to Dr. Lee. Dr. Lee, you mentioned tailor-made project based on local context. How you can ensure training activity will be suitable for your partner country? Dr.
Thank
Lee.
you for this question. As my presentation
Please
mentioned,
unmute.
when conducting training for healthcare personnel, the TaiwanICDF adopt
Please
TOT
unmute.
approach.
We cannot
Will
hear you.
see instructor receiving training in Taiwan. And they will prepare teaching
Dr.
material
Lee,
for local workshops.
please unmute your mic.
Okay. Microphone text. Text.
I will try to get Dr. Lee.
Yes. Give me 10 seconds. Okay, let me
I think
answer. Can
there's
you
a
hear me?
problem because the mic is not, is mute. Let me repeat the question. No.
It's okay. Hear the voice? Hear my voice? Yeah. It's okay, Dr. Huang?
Maybe I should repeat the question
Okay, please.
and ask Dr. Lee to
Yeah.
unmute the mic.
Okay.
Let me repeat the question. The question is,
Okay.
Dr. Lee, you mentioned tailor-made project based on local context. How you can make sure training activity will be suitable for your partner countries?
Thank you for your question. So as my presentation mentioned, that when conducting
there seems to be
training
a technical
for
problem,
healthcare,
so we will
technical problem.
we'll give answer on the Facebook or website.
Yeah, later. Okay. So Taiwan ICDF adopt TOT approach, while C instructor receiving training in
Okay,
Taiwan.
now there comes a third question. And I will read out and then maybe invite I think I can invite President Chen to answer this question. The question is, how are the time cost impact to nurse consider or support to help achieve the goals and requirements of this program while maintaining current roles?
Thank you for the question. Yes, I think during this COVID pandemic, nurses are very, very intense in their workload. On top of this difficulty during this fighting COVID-19, I think nurses also show their resilience and their strengths in every role in professional development. I think it's the matter of whether or not you want to have your significance to be seen or to be heard. I think in Taiwan, nurses demonstrate a good evidence that even all this time we have spent in doing all our ordinary tasks to fighting the virus unknown, we also spend time to empower ourselves, to have our professional role to be seen and to be heard, to demonstrate to the rest of the world that we nurses can do.
Thank you, President Chen. I think due to time limitation, the rest of the question we will answer later on the Taiwan ICDF website and Facebook. Now, we will have Pamela, Vice Minister of Hospitals, Ministry of Public Health and Social Welfare, Dr. Francisco Jose Martin, to give us closing remarks.
Distinguidos invitados, damas y caballeros, es un gran honor para mí tener la oportunidad de concluir este seminario web sobre el impacto del empoderamiento de enfermería en el sistema de atención médica. En primer lugar, me gustaría expresar mi agradecimiento a TaiwanICDF, a la Asociación de Enfermeras de Taiwán y a CARE por organizar este evento. Este seminario web ha aportado diferentes perspectivas desde la academia, de la salud pública y de los actores humanitarios y de desarrollo. Agradezco a todos los ponentes por sus valiosas aportaciones. Las profesiones de enfermería y partería pueden transformar la forma en que se organizan las acciones y de esta manera acercar la salud a las comunidades donde más se necesita. El gobierno de Guatemala se ha comprometido a empoderarlas, involucrarlas y también a inspirarlas a participar más en el liderazgo, la toma de decisiones y la formulación de políticas. Nos complace tener algunos socios excelentes como Taiwán para trabajar juntos en el camino, más en este año en el que la pandemia del COVID-19 representó un desafío para el mundo. El proyecto de cooperación para mejorar la salud materna e infantil, el desarrollo de la capacidad del personal de atención de salud de los hospitales y de las comunidades, incluidas las enfermeras y las parteras, es fundamental para alcanzar los resultados. No debemos escatimar esfuerzos para asegurar que a nivel internacional la participación de enfermeras y parteras en las iniciativas de la Organización Mundial de la Salud para ampliar la educación y la formación transformadora serán cumplidas. A nivel nacional, incluimos el desarrollo de la enfermera y la partera como parte integral de los planes de salud nacional o subnacional. Y a nivel individual, cambiamos nuestra forma de pensar y avanzamos juntos hacia la cobertura universal de la salud. Este seminario web ha sido un éxito. Agradecemos desde ya su participación y les pedimos su mejor entrega. Gracias.
Thank you, Vice Minister. Before I close, we still have one more question. That is, will this be recorded and available for watching later? Since the transmission has been interrupted, yes, we do have record and will be available for watching later. Okay, now we are going to close our webinar today. I think our webinar is very successful. I want to thank all the speakers and all the participants for your participation. Goodbye now.